do maybe 10 or 15 seconds for each question. So question number 1, which of the following is a possible complication of COVID-19? ARDS, acute renal failure, acute ischemic stroke, acute inflammatory demyelinating polyradiculopathy, acute myocarditis. All of the above are correct, or only choices A, B, C, and E are correct. Choices A, B, C, and E are ARDS, acute renal failure, acute ischemic stroke, and acute myocarditis. Maybe 5 seconds. And we'll move on to the next question. Which of the following is expected to be low in severe COVID-19? Will it be A, C-reactive protein, B, D-dimer, C, lymphocyte count, D, ferritin, or E, lactate dehydrogenase, or LDH? 10 seconds. Okay, we'll move to the next one. Based on existing literature, the incubation period, which is the time from exposure to development of symptoms of SARS-CoV-2, is thought to be within which of the following? Is it A, 7 to 10 days, B, 1 to 5 days, C, 2 to 14 days, or D, 14 to 30 days? 10 seconds. Okay, we'll move to the next one. Results from a recent randomized control open-label trial evaluating the efficacy of lopinavir/ritonavir, also known as Kaletra, in patients with severe COVID-19 showed which of the following? Is it A, decreased time to clinical improvement when compared to standard care, B, increased time to clinical improvement when compared to standard care, or C, no difference in time to clinical improvement when compared to standard care, or D, time to clinical improvement was not evaluated in this study? 10 seconds. Okay, we'll move on to the next one. Number 5, a previously healthy 18-year-old male presented to the Accident and Emergency Department with fever and right iliac fossa abdominal pain. After your assessment and investigations, you diagnose him with acute appendicitis, and following initial resuscitation, decide to list him for an appendicectomy. His nasopharyngeal swab for SARS-CoV-2 results are not back, but he requires urgent surgery. Which or how will you approach management of this patient? Will you A, assume he has COVID-19, use full PPE and perform open appendicectomy, or B, assume he does not have COVID-19, use standard theater mask and gown and perform open appendicectomy, or C, assume he has COVID-19, use full personal protective equipment and perform laparoscopic appendicectomy, or D, use standard theater mask and gown and perform laparoscopic appendicectomy because the risk of COVID-19 is low in this young patient? 10 seconds. Okay, we'll move on to the next one. When operating on patients during the COVID-19 pandemic, the virus has been shown to be present in which of the following? A, nasal and pharyngeal swabs, B, sputum and blood, C, bronchial swabs, D, gastrointestinal tissue and stool, or E, all of the above. 10 seconds. Okay, we'll move on to the next question. It is advised that this is question number 7, it is advised that operating theaters during the COVID-19 pandemic utilize negative pressure flows to reduce cross-contamination. If negative pressure systems are not available, how long should you wait before sending for the next patient? A. 5 minutes, B. 10 minutes, C. 30 minutes, D. 45 minutes, or E. 60 minutes. Okay, we'll move on to the next one. Number 8, during pregnancy, COVID-19 increases the risk of which of the following? Will it be A. first trimester miscarriage, B. second trimester miscarriage, C. congenital anomaly and teratogenicity in the fetus, or D. preterm labor, or E. hydrops fetalis? 10 seconds. Okay, we'll move on to the next one. Number 9, the antenatal care visits frequency for pregnant ladies during the COVID-19 outbreak should be A. every week, B. every 2 weeks, C. every trimester, D. infrequent, unless clinically indicated, or E. none of the above. Okay, we'll move on to the next one. Regarding the severity of SARS-CoV-2 infection during pregnancy, which of the following is true? A. most patients have severe symptoms. B. most patients have mild to moderate symptoms. C. most patients are asymptomatic. Or D. most patients will need hospital admission because of the risk of rapid deterioration. 10 seconds. Okay, we'll move on to the next one. A 7 millimeter, this is question number 11. A 7 millimeter upper ureteric stone is discovered in a patient with fever and a white blood cell count of 19,000. What is the first step in the management of this patient? Will you A. call the consultant as the patient will need emergency stent insertion? B. management of sepsis with IV antibiotics and IV fluids. C. 2 liters of IV fluids to help with pushing the stone down the ureter. Or D. notify the ICU team as the patient may require circulatory support. Or E. none of the above. 10 seconds. Number 12, what is the role of alpha blockers for small, less than 5 millimeter distal ureteric stones in an aseptic, pain-free patient? Is it A, the patient should be offered alpha blockers, or B, the patient can be offered alpha blockers, or C, the patient should never be offered alpha blockers, D, alpha blockers cannot be offered to females, or E, none of the above? 10 seconds. Okay, we'll move on to the next question. Number 13, when evaluating patients with hematuria suspected of having COVID-19, guidelines suggest avoiding which of the following to decrease the risk of novel coronavirus transmission? A, transabdominal ultrasound, B, digital rectal exam, C, administration of non-steroidal anti-inflammatory drugs for pain control, or D, intravenous urogram, or IVU. 10 seconds. Okay, we'll move on to the next one. Which of the following is the most preferred management strategy in acute kidney injury requiring dialysis in a COVID-19 patient who is hemodynamically unstable? Is it A, perform intermittent hemodialysis, B, perform peritoneal dialysis, C, perform continuous renal replacement therapy or CRRT, or D, avoid dialysis until the patient is hemodynamically stable? Okay, we'll move on to the next question. Number 15, all of the following are correct in acute kidney injury COVID-19 patients except A, COVID-19 patients could receive anticoagulation during renal replacement therapy. B, peritoneal dialysis is the modality of choice for renal replacement therapy in mechanically ventilated patients. C, the use of intravenous fluids should be limited. Or D, renal ultrasound should be limited to minimize exposure. Okay, we'll move on to the next one. Number 16, which of the following is correct regarding end-stage renal disease patient or end-stage renal disease management in COVID-19 patients? A, continue intermittent hemodialysis if hemodynamically unstable. B, SARS-CoV-2 positive patients can be dialyzed in the same room with other non-COVID patients. C, peritoneal dialysis patients should have at least 2 weeks of dialysis supplies and sufficient medications. Or D, sick dialysis nurses could wear a mask and resume working while pending SARS-CoV-2 testing results. So which of the following is correct? Then we'll move on to the next question. Number 17, how should medical waste be managed during the COVID-19 outbreak? A, waste coming from facilities treating COVID-19 patients should be subjected to additional disinfection. Or B, management of waste coming from facilities treating COVID-19 patients should be in accordance with routine procedures. Or C, there's insufficient guidance on how waste coming from facilities treating COVID-19 patients should be managed. 5 seconds. According to interim guidance published by the American Heart Association when resuscitating patients suspected or confirmed to have COVID-19, which of the following statements is incorrect? A, rescuers should put on personal protective equipment before arriving at the scene. B, limit personnel to only those essential for patient care. C, prioritize oxygenation and ventilation strategies with less aerosol generating risk. Or D, attach a HEPA filter securely, if available, to any manual or mechanical ventilation device in the path of inhaled gas before administering any breaths. Okay, and last question. According to guidance from the Resuscitation Council UK for the resuscitation of COVID-19 patients in non-acute hospital settings, which of the following is not recommended? A, starting with defibrillation for a shockable rhythm before starting chest compression when an AED is available. B, declaring or stating the risk of COVID-19 when calling emergency medical services or EMS. C, performing compression-only CPR and avoiding mouth-to-mouth ventilation using a pocket mask. Or D, listening for breaths by placing the ear near the patient's mouth before placing a face mask to deliver breaths. 10 seconds. Okay, and this is the end of the pretest. Thank you for participating. Please look out for the answers during the presentations that will follow in the future.